Dehydration occurs when the body does not have enough fluids to maintain normal bodily functions. Especially in the summer, the risk of dehydration is higher due to the hot weather increasing sweat production and causing the body to lose water more easily. If not detected and treated promptly, dehydration can lead to serious health consequences, even life-threatening conditions. Dehydration is classified into 3 levels: mild, moderate, and severe. Mild dehydration can usually be corrected by drinking more water. However, with moderate dehydration, intravenous fluids may be necessary. In particular, severe dehydration is a medical emergency that requires timely intervention and care to prevent dangerous complications. If the body lacks about 2% of its water content, feelings of fatigue will appear. A 10% deficiency can be dangerous, and if it lacks up to 20% of water, the risk of death is very high. Symptoms of mild to moderate dehydration in adults and older children usually include feeling thirsty, headache, dry mouth, urinating less than usual, dark-colored urine, dizziness, fatigue, or lethargy. Thirst is the first sign indicating the body needs to replenish water. When dehydrated, saliva production decreases, causing the mouth and tongue to become dry. Urinating less and having dark urine is due to the kidneys retaining water to maintain vital functions. Additionally, dehydration reduces blood volume, leading to low blood pressure, causing dizziness and lightheadedness. Body tissues lacking water will function less effectively, making you feel tired and lethargic. In infants and young children, signs of mild to moderate dehydration include urinating less, fewer than 6 wet diapers per day in infants, few or no tears when crying, dry mouth, sunken soft spot on the top of the head, and playing less than usual. Severe dehydration symptoms in adults and older children include no urine or very little urine, rapid heartbeat, rapid breathing, confusion, fainting. Infants and young children with severe dehydration may be excessively irritable or sleepy, urinate only 1 to 2 times a day, have wrinkled skin and sunken eyes. When these signs are present, the patient should be taken to a medical facility immediately due to the high risk of complications, including death. Causes of dehydration come from not drinking enough water or losing too much water from the body. Some common causes include physical activity, outdoors in hot weather, exercising a lot without timely rehydration, feeling nauseous, which leads to not wanting to drink water, or simply forgetting to drink water during the day. Some other causes of excessive dehydration include vomiting and diarrhea. These are the 2 leading causes of rapid loss of a large amount of water and electrolytes from the body. In particular, prolonged vomiting makes it difficult to replenish fluids because the water just consumed cannot be retained. Fever. When having a fever, body temperature rises, and the body will produce more sweat to cool down, thereby increasing the risk of dehydration. Excessive sweating commonly occurs during heavy labor or outdoor activities in hot weather, or when suffering from conditions that cause the body to increase sweat production. Frequent urination. Some diseases or side effects of medications can cause you to urinate frequently during the day, leading to dehydration. When is it necessary to replenish water? The body always needs to be regularly replenished with water, especially when noticing the above signs of dehydration. Additionally, in special cases such as fever, diarrhea, vomiting, prolonged physical activity, hot weather, or when urine appears dark, it is important to pay attention to increasing water intake more than usual. Preventing dehydration is especially important in the summer. To avoid this condition, one should drink water regularly and not wait until feeling thirsty to drink. For the elderly and young children, 2 groups more prone to dehydration, it is necessary to closely observe signs of dehydration to promptly replenish fluids. When engaging in physical activity or going out in the hot sun, it is advisable to carry water and take small sips regularly. In summary, dehydration is a common but dangerous condition, especially in hot weather or when suffering from illnesses that cause significant fluid loss. Early recognition of dehydration signs and proactively replenishing fluids are simple, yet very effective measures to protect the health of yourself and your family, preventing serious complications that may occur.